I'm a plastic surgeon and I'm going to be helped today by Melanie and Ruth, who are our nurses. So I'm the clinical director of Aurora Clinics and Cosmetic Courses. Aurora Clinics is a plastic surgical and non-surgical company, and Cosmetic Courses is a training company. So we're going to be talking today about lip augmentation. Has anyone here had any lip augmentation? Just one person? You're brave. Well done. So Carmel's our model today, so I'm going to be talking a little bit about lips. I'm going to be asking you questions as well. Yep, you. I'm going to ask you questions. And then I'm going to do a demonstration on Carmel. So Mel, next slide please. So there's 4 factors in facial aging. Okay. One is the skin quality, which lots of stands here are talking about. One are active lines, which are caused by muscle activity. So how do we treat active lines, do you think? Lines caused by, we relax the muscles. Gravity changes are generally treated with, surgery is the best way really. And volume changes are by restoring volume. Okay, so next slide. Okay, so that lady there, you. So this is a famous picture. How old does the lady on the left look? Yeah, Lau? Oh, you've done it. Oh, you know. Blonde lady. Blonde lady? You? Yeah. How old's the lady on the left? Go on, shout up. Sit. Yeah, and the one on the right? 80. Everyone agree? So why is it a famous photograph? Who said that? Yeah, they're twins, so they're identical twins, and they both as young girls went to work in a country house, and the lady on the left was a chef, and the lady on the right was a gardener. Yeah? So 20 years of difference, and why do they look 20 years different? What's the one on the right head? Sun damage, yeah. So that's why you've got to protect your skin. Okay? Next photo, Mel. So how old is the lady there? So how old is this lady? 30. Do you all think 30? 25? 40, higher, yeah. So she's 40, okay? So these are the average patients we treat. Next slide, please, Mel. So what's happened there? How old is she there? 60. And the next one? No. So let's just go back a little bit. So how old here? So let's say she's 40 here. Okay, next slide. So what's happened? Just go back a little, go back to the first one, Mel. So let's say she's 45 here. Okay, and then if you go to the next slide. Okay, so what's happened in those 10 years? So she was 45, and the next one's 55, and then that's 65, Mel, and that's 75. Okay, so this is a friend of mine who's, she aged herself, so she's trained in sort of Photoshop and everything. And if anyone wants to know how they're going to look in 10, 20, do you want to know how you're going to look in 30 years' time? No? No. So if anyone's interested, you can do that. So what we're trying to do is halt the signs of aging. So we're trying to keep everyone looking natural and stop things progressing. So next slide, please, Mel. Okay, who is this? So, shout up, shout up.
Jessica Parker.
What's her name? Sarah Jessica Parker. Okay. Are they all Sarah Jessica Parker? So which is the real one?
The middle.
So the middle one's the real one, yeah? So what's the one on the left? That's right. Shout up. Yeah, so which mirror image is that one over there? So yeah, so the middle one's the real one. The one on that is 2 right sides, and the one on the left is 2 left sides. So gentlemen there, which is the most attractive one? You like the one in the middle? Anyone else? Left?
Left side.
Left side. So could look at her eyebrows, you see. See how asymmetrical she is. So her left side is wider with higher eyebrow. Okay? So you can see 2 right sides, her face looks wider and more masculine, and 2 left sides, and 2 right sides she looks more feminine. Okay? So that's why it's always really important to look at our models for asymmetry. And Carmel who's our model here, is a little bit asymmetrical, which we'll show you in a second. Okay? Next photo, please, Mel. Who's this? Anyone know who this is? Gwyneth Paltrow. Okay, now we've done the same thing, reverse the rights and the lefts. Does she look very different? No? So is she more symmetrical than Sarah? She is, isn't she? Yeah? Okay. So generally symmetry is associated with beauty. So the more symmetrical the face, the more beautiful it's considered. Okay, so next, right. So fuller lips are considered more youthful. Okay, so can we go on to the next one, please? And, yeah? Is that attractive to you? No. No. Yeah. But more attractive baboons with bigger rear ends are considered more attractive than the male baboons. Yeah? Okay, so now we've got an analysis, so we're aiming to create natural, beautiful lips. Most importantly, that they're age appropriate. So can we just go to the next one? Okay, so how old is this person? Just by looking at their lips, how old?
25.
25, no. How old are those lips? It's a baby's lips. Baby's lips. Can you see the food on the bottom of the lip? Yeah? See the baby food? So they're a baby, so you know they're a baby's lips, don't you? Would it look appropriate if your mother had lips like that? Would it? No, no. Okay, so when you look at lips, you know that we analyse lips in width compared to the height, okay? So the width here is 11 centimetres and the height is 50% of that. So for a baby, a 50% height to width analysis is fine, okay? But that wouldn't look appropriate on an older person. Go to the next one, please, Mel. Okay, how old is this person? Just by looking at their lips. Yeah? They're teens or 20s, aren't they? Okay, what's their analysis? 45%. So this is the proportion, it's the height compared to the width. Okay, next one, please. Next one, yeah. How old is this person? 40, yeah, probably 40, 50. But can you see the lips are starting to deflate? They're starting to get more lines on the lips. And what's the number there, Mel? 32%. So as we get older, the lips get lower compared to their width. Yeah? Next one, please. And this, how old is this person, do you think?
60.
60. So why is she 60?
Lots of wrinkles.
So why, come on, shout it. Why is she 60 from her lips? So she's got deflation, she's got some vertical lines, and you can see the skin is older skin. Yeah? Okay? And it's 27%. So a baby, the number's 50% height to width, but in an older person, more like 27%. Okay? Next photo, please. So, do we want to create this? What's her percentage, do you think? Do you like that look? Do you like that? Yeah? Okay. So is that a good look? No? No, we don't want to do that, do we? Do you think Carmel wants that?
I don't think so.
Don't think so. To Carmel? She's looking a bit worried, isn't she? Okay, so next photo, please, yeah, go on again then. So we want to create age-appropriate lips. We want to create youthful-looking lips that are appropriate for that person's age. So next photo. So who's that? Cameron Diaz. So she's in her 40s, lips look great. Next photo, who's that? Kim Basinger, lips look great. And they're appropriate for her age, aren't they? Next photo, who's that?
The Queen.
The Queen, yeah. So she's looking good as well. Next one. Okay, but it wouldn't be appropriate for Judi Dench to have great big lips, would it? So we just want to create people that look good and healthy, but not unnatural. Next photo, please. So what we want to do is create something that really keeps people guessing. People look good, but we don't want it obvious that they've had treatment. Because if it's very obvious you've had treatment, people presume you are older. Yeah? Okay, so next photo, please. So anyone, this is a prize question, who's that?
Very beautiful.
She's been in the news recently at the Oscars. Yeah, so she's Kim Novak, okay, American actress. That's her in the 50s, 80s. Keep going. Next one. So here, so she doesn't look. Does she look natural here? Yeah. Does she look natural? Yeah. Next one. Okay. So does she look natural here? Has she passed the line of naturalness? Yeah. Next one. Okay. This is her. Does she look natural there? Okay. So let's just go back a little bit. PPP. Okay. So looks great. Natural. Next one. Still looks great. Next one. Starting to lose volume. Has had some surgery around her eyes. Next one. Had a facelift. Starting to look very unnatural, unbalanced. And the next one. She's had a lot of fillers, a lot of treatments, hasn't she? So we don't want this, do we? No. Next one. So we want natural, age appropriate, and to keep people guessing whether they've had treatment or not. Okay, next one, please. So these are good examples. Who's the lady on the left? Angelina Jolie. Are her lips natural, do you think? I'm not sure, because we've analysed photos of her. She had very full lips when she was young, and then she went through a slightly deflated stage, and then she got slightly fuller. Okay, so I think she's had a little bit of help recently. And how old's Liz? Hmm? She's late 40s. So is she natural? Does she have treatments? Does Liz Hurley have treatments, do you think? Yeah. So what, she's not here, is she? No. So what treatments do you think Liz Hurley has? Just, okay, is her forehead natural? There's definitely Botox, fillers, skin peels. Are her lips natural?
There is a slightly
Teeth, yeah, she brushes her teeth regularly, doesn't she? Yeah. Okay, so next one, please. Okay, so just to recap, you all know the anatomy, but just to rerun these areas. These are the areas around the mouth which we're going to be treating, and we're going to be treating these in our demonstration. So, next one, please. Okay, so what I'm going to be showing you this afternoon is a technique where we just use one entry site with a cannula. Okay, so how many of you do lip treatments regularly? Put your hands up. So lots of you. About?
occasionally.
Occasionally. So who would consider themselves who does over 10 a week? 2 people, okay. So what technique do you use? Eh? Not cannula. What technique? You do use cannula. And you like a cannula. She loves cannulas. All right, so what we're trying to do, the reason for using a cannula is it's one entry site, it's less painful for the patient and better tolerated. Okay, so next one. So this is our model today, Carmel. Come on, Carmel. Okay, do you mind having a seat just on the end, Carmel? So Carmel's had fillers before, but not that recently. So we're going to be treating her perioral area. Okay. So the idea is I'm going to be entering here and filling up the lips from there and there. Okay. So any questions about what we're going to do?
It's one entry either side.
Oh, well, I hope so.
Yeah.
Sometimes I fall out and have to do it again. If I do that.
Is there enough local anesthetic or do you have to give that?
Well, I've cheated a little bit because I've given Carmel a dental block about 20 minutes ago. So are you numb now, Carmel?
I think so.
She thinks she's numb. You don't need to really, but I thought because Carmel's a bit sensitive. Yeah? Right, so come and have a lie down, Carmel. So one more slide, yeah. Have a look at Carmel. Is Carmel attractive? Yeah? What are you going to say? Is she attractive?
Yes.
Yes, she is attractive. So up a bit, yeah. Okay, how old is Carmel? 50, you say? 50? How old's Carmel? Do we say? I don't know how old she is, actually, but I think she's 50-ish. So she looks. So are most of your patients going to look younger or older than their peers?
Younger.
They already look a bit younger, don't they? And they look better. Okay, so I'm going to put some gloves on now. I've got some gloves there, Mel. Okay, so Mel's going to talk a little bit as well. Okay, so you got the. So, can everyone see on the screen and everything? Can you see? Can you see? Okay, so which areas do you think Carmel needs treating? Yeah, come on, shout up if you're going to. Upper lip, yeah. Where in the upper lip? Huh? So where would you treat? So who would treat the body of the lip? Yeah? How much would you put in? So who would put, so per in the upper lip, who would put under 1 mil? Under 1 mil, everyone? Okay. How much would you put in a nasolabial? How much, what volume do you think I should treat nasolabials, upper lip, lower lip and marionette lines on Carmel? Huh? 1 mil in total, you think? So you'd go, what would you go? You go mil. So you'd do 2 mils in total. So 1, 2, 3. And what about here? Shout up. You'd include that. So you do 1, 1, 1, and 1. Yeah, good. Everyone agree with that? Yeah? You agree with that? Okay, good. And what would you use? Juvederm what? Yeah. Okay. Would anyone use anything else different? What would you do? You'd use Juvederm 2.
3 and 2.
You'd use 2 in the lips, would you?
Yeah, 2 in the lips.
Okay. Anyone, any other, what would you use? You'd use Juvederm 3. How many would you use? 1 mil. 3 mils. Would anyone use more than 3 mils? Would you? You might. Okay. All right. So Carmel, are you feeling okay? So chin up. Can we just lower this a little bit, Mel? So who treats with patients? What position do you use when you're treating a patient? Like that. Okay. Great. Could the table go up a bit? I've got the needle. Okay. So if you've got any questions, just shout out. I've got a needle. So what I'm going to use, first of all, I'm going to use a needle to make the hole. Okay? Okay, you all right there? Mm-hmm. Okay, so open up there, Carmel. Okay, open up. So I'm just making a little hole. I've got to try and remember where the hole is. Is that hurting you, Carmel? Okay, so where would you treat first? Where should I go first, guys? Where do you want me to go first? Shall I do here first or the lip first? Come on. Nasolabial first. Okay. You're right, Carmel. So although they're called dermal fillers, they're not really dermal fillers. So when I do facelifts, I do a lot of fat transfer. So I would typically do this. Open your mouth, Carmel, for me. I would typically do this with fat, and I do it very much just with feeling. And I use slightly larger cannulas normally. Okay, so I'm just really just feeling where I'm going. Will you explain what I'm doing, Mel, as well?
It's just using that sort of linear threading technique, needle in as you come back with the needle, just to deposit a little bit of product.
What product do you use?
Juvederm 3. This is Juvederm 3.
And I'm just trying to put it in different levels, okay?
To build up, so kind of an under level and a little bit on top, and a bit on top.
So what I want to do, it's a bit like building the foundations of a house, I always think. So I'm trying to go slightly deeper and then building up all little strands in different areas, okay? So I'm trying to do...
The Juvederm 3 is quite...
Shout, Mel.
The Juvederm 3 is quite thick, really, through what is actually relatively quite a fine cannula. But you wouldn't really want to use much bigger in such a delicate area. Sorry? 27. It's a 27 gauge cannula, 1.5 inches.
Okay. So now I'm going to... Can you feel any of this, Carmel? A little bit. Now I'm going to move into the body of the lip. And it's all done by feel, so I'm feeling... I'm just under the middle part of the lip here. And it's all done by feel. Is this what you do pretty much? Am I doing anything wrong? They do a bit, don't they?
I think it was a little bit more just because she was in front of all these people.
Okay, you're right, Carmel.
Generally, we probably wouldn't.
Okay, now I'm going up right.
I wouldn't.
So I'm going right up the white roll now. So I'm going to do a vermilion border, augmentation.
What cannulas do you use?
These TSK?
Yeah, I know so.
So I'm going right up the vermilion border now. Okay. So I do it very much on feel. You okay, Carmel?
Mm-hmm.
They're quite bendy, these cannulas, aren't they, Mel?
Yeah.
So now I'm into the lower lip. Open up for me.
You've got enough product there. Do
I need a bit more in a minute.
Got it ready.
So I can feel it between my fingers just filling up, okay? So it's all done by feel, so I'm just feeling the lip inflate. Okay.
Doing very well.
Okay, so that's 1 mil gone. Just undo here. You've done that. Okay. Okay, come. Okay, open up for me. Okay, so I'm right in the lip. Can you see I'm right in the lip there? So now I'm going to just go down the vermilion, vermilion border. As I said, all done by foot. You can bend these cannulas if you like. So now I'm in the vermilion border. I'm just doing a vermilion border. The great thing about using fat is it's the patient's own treatment. Okay. Now we're just going to reassess. That's good. Carmel, open up. Where do you think we need a bit more? Open up for me a bit more. So now I'm just going to do corners of the mouth a bit. Any questions so far? Any questions?
Do you find that when you do fat transfers,
Yeah, shout.
when you do the
Hang on,
fat
show it.
Yeah.
do you find the longevity becomes much? I've never done a fat transfer, but
Yeah, it is good.
I know some patients that have, of mine that have had fat transfer, but they've said it's never lasted very long. You get a very good result,
Yeah.
but it's, and I think, you know,
No, it doesn't
last that long.
Let's have a look. What do you think so far, Mel? That's looking good. Bit more in the...
Nice lip,
Just open up for me.
maybe a little bit more, but it's just quite a nice natural look.
Now, the trouble is about fat. Where do you think you take fat from?
Don't they normally take it from the stomach? in particular?
Yeah. So the trouble with taking it from the stomach is, if you put weight on, the fat that you transferred acts like tummy fat. So what happens if you put weight on? Yeah? So the best fat is actually from the inner knee areas. Right, guys, do you think Carmel needs any more?
Oh,
Open up.
sorry.
What do you think, Mel?
Maybe a little bit. Put, yeah, the rest of what you've got there, perhaps in that top lip.
How are you feeling? So I'm trying to put it in multiple different, I'm not trying to put it in one big blob, I'm trying to put it in different sort of levels, okay? That's good, okay. So that's treatment there, so that's 2 mils I've used there, and I can feel all the volume dispersed throughout the lip. Okay, any other questions for anyone? Yeah, lady there? Okay. Great. So then we're going to swap sides. You're right. Can you feel anything?
Ask.
Yeah.
When you use the I usually go in with a needle normally. When you go with the cannula, it's quite, not aggressive, but you're going in there and really working around the lips.
Yeah.
Do they get any bruising or is there risk of, I mean, obviously the cannula could damage any of the arteries or nerves, or are there any precautions you need to take with the cannula?
No. Well, it was very fine cannula, so just keep it moving all the time.
Do you back aspirate
Yeah.
as well?
Yeah. Now, can I remember where my mark? You've got the needle again. You need to. Actually, I can see it there. So how many? So can you see the cannula right under the skin there? Can you see that? Yeah. So I can just advance it up. See? So I'm right in the corner up there at the alar base. So I think with fillers, always keep the needle moving, because you don't want to occlude. So it's like with anything, always try and inject on the way out. And I think most of the issues you get with dermal fillers is because if they're placed too superficially. So are dermal fillers really dermal fillers? Okay. Are dermal fillers put in the dermis? No. So it's moving on to the body of the lip now. So I can feel, so I'm going to use 4 mils on Carmel today. So I'm just filling up the body of the lip now. Okay. Okay, and then now I'm going to try and get into the, without pulling my needle out, try and get along the white roll. See there? Can you see I'm right in, see the end of my cannula there?
Actually, if she turns slightly that way, it might
Yeah.
film.
Okay, let's move into the lower lip now. You're right, Carmen. Nearly there, Carmen. So I'm just, that's good. So would anyone use 4 mils? Would anyone use 4 mils? No, there you go. Open up again, Carmel. So now I'm just going to do a bit more in the body of the lip. Do you get a lot of bruising with your needles? Okay, we're going to do that middle-y bit thing. A little bit of spotting now. Okay.
The last of the 3.
Yeah, this is the last one I'm going to use. So what we try and do sometimes is what we try and do is press the middle of the lip. So if Mel holds there, with the lower lip, what we're trying to do is create a sort of a bow. Does that make sense? With the depression. If you look at Angelina Jolie's lips, she has a central depression. So using this technique, we could just create a bit of a bow. Now, so with the longer cannulas, from here, I can get right up into the cheeks. So I can fill the fat pad here. So just from one entry site, I can get to all areas. So I only need to make one incision, one little hole. Okay, that's great. Thanks, Mel. Okay, open up for me, Carmel. So just filling up the marionettes now. Any questions, Mel?
Any other questions? I think the thing with the cannula is what I found with the cannula is that I started using needles and then just sort of one day thought, I think I'm going to give it a go. And I have places where I prefer to use cannula and places where I prefer to use needle. And generally, I think you have to choose your patients as well for cannula, because sometimes it does seem to be a little bit kind of brutal, isn't it? That sort of force. So you have to explain to them that it might feel as if I'm not able to get it in, but actually it's causing less trauma than the sharp needle.
So any questions about that? Hello? So I just massage. Who massages a lot? Who does a lot? Do you? Yeah, just to make sure it's all even. How are we doing time-wise?
I think we're probably another 5 to 10 minutes. We've got 2 more slides, 3 more slides. One with
Yes, that feels good. Well done, Carmel. How was that for you? Good. She's not talking to me now. Great. So any questions about cannulas?
I've got 2 questions about lips. The first one is, for a patient with thin, particularly upper lips,
Yeah.
what would be your tip to avoid that double shape? Would you just avoid using the removing border and
Okay.
the treatment?
So I think you've got to analyse the lips from the side. Okay. So if you look at your face and you draw a line, have you got something? It's okay. So do you know your nose and your chin should be on a line with your lips? So have I got a big chin? Who said yes? You said yes, didn't you? So have I got a big chin? Yeah. So when I put my line here, my lips don't reach the line, do they? But someone who's perfectly proportioned, their upper lip should lie on the line, okay? So what we don't want to do is go too big. We don't want to go past the line, okay? So I think what happens with duck lips is you get too much filler actually in the area above. If you do too much filtral treatment or upper lip treatment, that's what tends to give you the duck look. Say again?
That leads me to my second question. What would be your tip to evert the lip? So you've got somebody who's got probably good volume lips, good size, but they're just inverted.
Yeah, I think you need to put little pillows of filler posteriorly. But, yeah, quite hit here to push the lip forward. So if you want the lips to go forward, like that, you have to put little pillows either side, but quite posterior in the lips to push them out. Does that make sense? What do you do, cannula lady? Yeah? So where do you shout out? Where do you put it when you want to? Yes, if you put some here and on either side of 2 pillows, it pushes the lip forward.
So it's in the wet part of the lip? Wet, dry area?
Yes.
Yeah.
Yeah. Is that okay? So when you do the lips, you're trying to get, because when you cut through the lips, there's skin and then there's the muscle of the lips, and the muscle's right underneath the skin. So really you are in the muscle. Yeah? Does that make sense? Because when you cut the skin, there's skin, fat, and then the muscle layer. So when you're doing Botox in this area, how much fat is there? So how much fat is there between the skin and the muscle here?
Very minimum.
Minimum. So when we teach on our courses is when you inject Botox, or botulinum toxin, it disperses for 5 millimeters each way. So we teach people to sort of think in centimeter circles. Yeah. So roughly the size of your thumb is how far the toxin will disperse, and it also disperses downwards 2 or 3 millimeters. So most of us are now doing very subcutaneous injections, aren't we? Okay, so when I learned to do Botox, so who's been doing Botox here for longer than 10 years? You're old, you're old. How old are you? How many of you have been doing it for? 12 years. Yeah, so I learned 12 years ago, and 12 years ago, how many people were there in the UK doing toxin treatments? It was you, me, you. That was it, wasn't it? So there was no courses in the UK, so when I had to go and learn from a surgeon in Harley Street, And the teaching in those days was you put your needle in till you hit the bone, and then withdraw and then inject. Okay? So why was that a bad idea? Why was that a bad idea, guys? What? So why is hitting the bone bad? Yeah? It's painful, blunts your needles and gives you bruises. But the most important factor is, you know the complications of Botox, eyelid ptosis, yeah? And strabismus. We used to see quite a lot of those 10 years ago, because if you inject down to the bone, you create a potential tract for the toxin to go down into the orbit. That makes sense? So if you're very superficial, if you just pop through the skin, the toxin can't disperse anywhere. But if you go down towards the bone, it can travel down along the periosteum, and that's how it gets into the orbit. So has anyone seen an eyelid ptosis? Has anyone here seen an eyelid ptosis from Botox? No. Okay, so what would you do? Okay, so there's a friend of mine, a plastic surgeon, and he treated a patient with dysport, and she didn't come back for a year. So he treated all the normal 3 areas, quite a hefty dose, and she comes back after a year and says, he says, how are you? And she says, I'm fine now, but I've had a terrible year, because soon after I saw you last time, I developed a squint. I went to my GP, they thought I had a brain tumour. They took me in hospital, they did MRI scans and lumbar punctures, yeah? And then my squint went away after 3 months. So she had not put together the fact that it was the treatment that caused the thing. So what would you do? Would you tell her? You wouldn't tell her. Who would tell her? You'd tell her, would you? You'd tell her. So a cannula girl would tell her, but you wouldn't, no? No. Say that again? She should have done
The information in the beginning.
Sorry, say that again. She should. Yeah, so do you tell people they can get squints, and do you? Yeah. Does everyone tell them they can get squints? Yeah. Is it in your written stuff, or is it, do you actually say? It's in your written. Do they read all your written stuff? I read it to them. You read it to them, do you? Yeah. Well, good. So I think that's probably our time up, is it, Mel? There's a couple more slides. So take-home points. Let's keep them. Let's create something that looks beautiful and natural and is age appropriate. Remember, it's your name on their faces. Okay, so it's your. You've done it. So there is a plastic surgeon in America who got into trouble for signing his initials on a patient after an operation. On their liver. Is that? So is anyone going to see the liver? No. But is it appropriate to sign your initials in the liver? No. Okay. So what we don't want to create, can we just carry on? Is anything, we don't want to create duck looks. We want to keep people guessing, create really lovely lips and faces. And I think if you're not using cannulas, start using cannulas. Just try. Which ones do we use, Mel? Are they here today? Is anyone here from TSA? TSK. So you can get them from Healthcare Exchange. So I would try, and which ones do we use, Mel?
TSK 27 gauge, 1.5 inch.
That's the one to use. All right, guys, so well done. Get cannularing.